Nour Alrabie is a doctoral student in management and accounting under the direction of Sandrine Fernez-Walch. She is researching efficiency in the French healthcare system, and in spring 2017, she will be a visiting researcher at St. Anna School of Advanced Studies in Pisa, Italy. You're researching efficiency in the French healthcare system. Can you tell us more about your research?
Well, my research is held about how can evidence-based management help in ameliorating efficiency in healthcare systems. I'm going with the logic that if healthcare professionals and managers are adopting evidence-based management concept in their own practice or daily practice, they would ameliorate the efficiency on their own level, that is the micro level, and that will be after that useful for meso level, that's the second level, and finally for the macro environmental. So starting with managers, we can make kind of a change in efficiency for the whole system.
What is an integrated care model?
Well, integrated care model, it's kind of model that is developed since 70s. Well, let's say first degree, if we talk about coordinated care, it's about coordinating different services and different professionals to work together. While integrated care is a level more developed and in which they will work together in a collaborative way. So they would be all working around the patient in order to offer a better service. Actually, integrated care, in the theory, it's highly developed. There is so much many approaches, but for the implementation, there is so much evidence, and it's important to find ways to develop such concept and to make it operational. And that's why I'm coming with the evidence-based management concepts.
When some people hear management and healthcare together, they think people are only looking to cut costs, regardless of the care. What do you say to them?
For me, saving money and managing health expenditure would allow to periodize the activity. So we will be able to offer health for all if we are rational in our expenditure. But actually, when we talk about efficiency, it's, in my approach, it's a critical approach. So I'm caring more about the procedural efficiency, the dynamic efficiency rather than numbers. So health life of people is so important. And so we have to be rational in resources using. So we will not be talking about cutting kind of service, but rather offering a better service and cutting practice that is useless, let's say.
What surprised you when you started researching the French healthcare system?
Well, when I started this study, let's say this research, it wasn't in the aim to develop efficiency, but rather to learn more about the best system in the world in 2000. The French healthcare system was classified by the WHO as the best in 2000. But living in France, I hear kind of problems related to systems, so I was curious to learn more. It's kind of hybrid system in which public missions are delegated to private actors. Private actors have kind of constraints, let's say, of public institutions. Regulation bodies are enormous, are so numerous. So it's kind of complex system, and general healthcare systems are complex, but the French is even more. So this what was surprising.
You were recently elected to the Research Council of the university. What motivated you to run for this position?
Well, I did that with the support of my colleagues. So I was first encouraged by my colleagues, and it was especially to represent the PhD students and such council that in this council we discuss PhD programs, PhD budgets, etc. So it was important to be there to represent my colleagues. It's also important to have let's say, an eye on how it works. So in the academic environment and administrative environment, and so that I can, let's say, it's kind of messenger with the PhD with my colleagues, so I can help the message to my colleagues. About the list, just I'd like to precise that it was a list interdisciplinary, so we did the list with different disciplines that like management, economics, mathematics, and law, because we do believe that we have to work together in a collaborative way.